Welcome to this crucial discussion about dementia awareness, a topic that affects millions of families worldwide. Every 65 seconds, someone in the United States develops Alzheimer's disease, the most common form of dementia. Yet despite these alarming statistics, early warning signs are often overlooked or mistaken for normal aging. Dementia isn't a single disease. It's an umbrella term describing disorders that impair memory, reasoning, language, and social behavior. The brain doesn't fail all at once. It gradually loses connections between neurons, especially in areas responsible for memory and judgment, such as the hippocampus and frontal lobes. Recognizing the early signs isn't just helpful. It can be life-changing. According to research from the National Institute on Aging, NIA, early detection allows for timely intervention, which can delay progression, improve quality of life, and even slow brain decline through medication, exercise, and nutrition. Many people mistakenly assume that memory loss is a natural part of getting older. But this dangerous myth prevents early diagnosis, when treatments and brain-protective lifestyle changes are most effective. While minor forgetfulness, like misplacing glasses or forgetting a name, can be normal, the signs we'll discuss go far beyond typical aging. When dementia is caught early, doctors can recommend medications such as donepezil or memantine, which may preserve neurotransmitter balance and help maintain cognitive function longer. Combined with lifestyle measures like a Mediterranean-style diet, regular exercise, and social engagement, the brain can retain more resilience. This video isn't about fear. It's about empowerment through early action. As we go through these 10 key warning signs, pay close attention. You might notice patterns in yourself or a loved one that deserve medical evaluation. Remember, the earlier dementia is recognized, the more options you have for support, planning, and slowing decline. 10. Trouble with visual and spatial relationships. Trouble with visual and spatial relationships is a complex but often overlooked early sign of dementia. Unlike normal age-related vision changes such as needing reading glasses or adjusting to low light, these difficulties arise from how the brain interprets and integrates visual information, not from problems within the eyes themselves. This symptom reflects changes in the occipital and parietal lobes, regions responsible for processing visual input, depth perception, and spatial orientation. Early on, individuals may begin to misjudge distances, bump into furniture, or struggle with everyday activities like climbing stairs, using escalators, or stepping off curbs. This happens because depth perception and spatial awareness, functions that depend on precise communication between the visual cortex and parietal regions, become impaired. In neuroimaging studies, reduced activity in these brain regions has been linked to spatial disorientation commonly seen in Alzheimer's and Lewy body dementia. Reading may also become more difficult. People might lose their place on a page, skip lines, or find that familiar documents suddenly look confusing or jumbled. These issues aren't due to poor eyesight, but rather the brain's inability to coordinate eye movements and interpret visual sequences. Similarly, driving becomes increasingly unsafe as judging speed, distance, and direction becomes unreliable. Tasks like parking or navigating traffic can feel overwhelming and dangerous. Another key sign is difficulty distinguishing colors and contrasts. Research shows that dementia can affect the brain's visual discrimination abilities, particularly in the ventral visual pathway, which helps recognize shapes, colors, and objects. This can lead to mismatched clothing, trouble finding items against patterned backgrounds, or missing visual cues in the environment, such as steps, signs, or uneven flooring. As spatial awareness deteriorates, balance and coordination are often affected too. People may appear clumsier, lose their footing, or misjudge doorways and hallways, increasing the risk of falls. Some individuals develop confusion with reflections and mirrors, a symptom known as mirror misidentification, where a person may fail to recognize themselves or react with fear or suspicion toward their own reflection. This occurs when the brain's temporal and occipital lobes fail to integrate recognition and perception correctly. Over time, these challenges expand beyond simple navigation errors. A person who once easily followed maps or familiar routes may now get lost, even in their own neighborhood. Multi-level buildings, patterned floors, or dim lighting can heighten disorientation and anxiety. Such confusion not only reduces independence, but can also trigger emotional distress, frustration, and fear. Scientific studies show that these visual spatial changes correlate with early amyloid and tau accumulation, the toxic proteins that damage neurons in Alzheimer's disease. This neurological disruption alters how the brain interprets space and motion, making environments appear distorted or unfamiliar. Fortunately, early recognition and adaptation can make a real difference. A professional evaluation by a neurologist or neuro-ophthalmologist can help distinguish between true visual impairments and brain-based processing deficits. Environmental adjustments such as improved lighting, clear pathways, contrasting colors on steps and furniture, and simple visual layouts can dramatically improve safety and confidence. 9. Changes in sleep patterns. Altered sleep patterns are a scientifically recognized hallmark of early dementia, often emerging before major memory loss becomes evident. These disturbances go far beyond normal age-related sleep changes. They stem from biological disruptions in the brain's circadian rhythm and sleep-wake regulation centers. The suprachiasmatic nucleus, SCN, in the hypothalamus, the brain's internal clock, becomes damaged in dementia, leading to confusion between day and night. This causes sundowning, a phenomenon where individuals grow restless, agitated, or disoriented in the evening. Sleep studies, polysomnography, have also shown that dementia patients experience reduced slow-wave, deep sleep and REM sleep, both essential for memory consolidation and emotional regulation. Insomnia, frequent nighttime awakenings and day-night reversal, sleeping during the day, staying awake at night are common. These disruptions worsen cognitive impairment, creating a feedback loop. Poor sleep increases amyloid beta accumulation, a toxic protein linked to Alzheimer's, which in turn further damages brain tissue. Research published in journals like Nature Neuroscience and JAMA Neurology confirms that even a single night of poor sleep can increase amyloid levels in the brain. Environmental factors such as unfamiliar settings, lack of routine, or excessive light exposure can further disturb circadian rhythms. The resulting sleep deprivation affects concentration, mood, and immune health, while also raising the risk of falls and accidents. To manage these changes, strategies include maintaining a consistent bedtime routine, optimizing light exposure, bright light during the day, dim at night, and avoiding stimulants. In some cases, doctors recommend melatonin therapy or cognitive behavioral approaches to regulate sleep. For caregivers, understanding these biological patterns is vital. It helps them plan rest schedules, reduce nighttime wandering, and maintain household peace. 8. Withdrawal from social activities. Social withdrawal is a subtle yet powerful early indicator of dementia, and it often develops so gradually that families mistake it for simple aging or introversion. But what truly happens beneath the surface is a neurological and emotional coping response to cognitive decline. People begin to avoid social situations not because they've lost interest, but because they sense their own cognitive difficulties, forgetting names, struggling to follow conversations, or feeling embarrassed about repeating themselves. This avoidance helps them hide their struggles, but ultimately accelerates cognitive decline. Neuroscientific studies show that social interaction stimulates multiple brain networks, including areas responsible for memory, emotion, and executive function. Reduced social engagement, therefore, leads to faster atrophy in these neural circuits. Furthermore, chronic isolation increases levels of stress hormones like cortisol, which can damage neurons in the hippocampus, the brain's memory center. Over time, this creates a vicious cycle. Isolation worsens brain health, and brain decline deepens isolation. Social withdrawal also impacts emotional well-being, often coexisting with depression and apathy. People who once enjoyed gatherings, clubs, or community events may now feel anxious, overwhelmed, or fatigued by the effort of socializing. Cognitive neuroscientists emphasize that maintaining consistent social engagement can help slow mental decline, preserve communication skills, and improve mood. Encouraging small group interactions, familiar routines, or social therapy programs can make a dramatic difference. Families can help by offering companionship, simplifying social settings, and ensuring the person feels included without pressure. Even light conversation, shared meals, or music therapy can strengthen emotional bonds and maintain neural stimulation. 7. Mood and behavior changes. Mood and behavior changes are among the most emotionally challenging early signs of dementia, both for the affected individual and their loved ones. These changes often appear subtly, a little more irritability here, a bit more withdrawal there, but they grow more pronounced as the disease progresses. What's crucial to understand is that these shifts are not character flaws or just aging. They stem directly from chemical and structural changes in the brain. Scientifically, these mood disturbances are linked to neurochemical imbalances and neurodegeneration in regions such as the frontal lobe and limbic system, which regulate emotion, impulse control, and social behavior. As dementia progresses, neurotransmitters like serotonin, dopamine, and acetylcholine become dysregulated, leading to emotional instability, apathy, and even paranoia. Studies using MRI and PET scans show that reduced blood flow and metabolic activity in the frontal and temporal lobes often correlate with mood symptoms like depression or aggression. In early stages, individuals may experience depression and anxiety, often months or years before cognitive decline becomes noticeable. They might lose interest in hobbies, withdraw socially, or develop irritability and restlessness. Apathy, or the loss of motivation and initiative, is another hallmark, caused by damage to the brain's reward and motivation circuits. Some may develop paranoid delusions, believing loved ones are stealing from or deceiving them, a symptom rooted in deteriorating reasoning and memory integration. These behavioral and mood changes often lead to sleep disturbances, social withdrawal, and relationship strain. Compassionate understanding and early medical evaluation are essential. With proper diagnosis, doctors may use mood stabilizers, antidepressants, or structured daily routines to stabilize emotional balance. Supportive therapy, environmental consistency, and caregiver education can also significantly reduce stress and improve quality of life. 6. Misplacing things and losing the ability to retrace steps. Everyone misplaces items occasionally, but in dementia, this goes beyond normal forgetfulness. It becomes frequent, illogical, and disorienting. Someone might put car keys in the freezer, a wallet in the bathroom cabinet, or milk in a desk drawer. What makes this different from ordinary lapses is the inability to retrace steps or recognize the mistake afterward. This occurs because dementia affects the hippocampus and temporal lobes, which control spatial memory and the brain's ability to record where objects are placed. Over time, the neural circuits that link context to action, such as remembering you left your keys on the counter while talking on the phone, begin to deteriorate. Early in dementia, misplaced items might still end up in logical but incorrect places, like leaving glasses in the bedroom instead of the living room. But as the condition progresses, placements become more irrational and harder to correct. Losing essential items such as medication, identification cards, or hearing aids can seriously compromise safety and independence. These memory gaps often cause emotional turmoil. People may feel embarrassed or frightened, believing others are moving or stealing their belongings. Family members might be falsely accused of theft, leading to tension and mistrust. Studies from the Alzheimer's Association report that this pattern, misplacing items and being unable to retrace steps, is among the earliest behavioral signs distinguishing normal aging from pathological cognitive decline. To support loved ones, families can create structured environments. Keep commonly used items in consistent places. Label drawers and cabinets. Use color-coded bins or trays. Introduce technology like key trackers or smart home reminders if the person can still manage them. Occupational therapists can recommend home adjustments that reduce frustration and enhance safety. Most importantly, respond with compassion, not blame. The goal isn't to correct every mistake. It's to create an environment where those mistakes cause minimal stress or danger. 5. Poor judgment and decision-making. Another major early sign of dementia is declining judgment, a shift in how someone processes information, makes decisions, and assesses risk. This isn't about occasional poor choices that everyone makes. It's about a consistent, noticeable change in reasoning, logic, and social awareness that can endanger health, finances, or personal safety. One of the first areas affected is financial judgment. A person might suddenly make large purchases, donate money impulsively, or fall for phone scams they would have easily spotted before. Others may become overly suspicious, refusing to trust banks, relatives, or advisors. These behaviors are linked to changes in the prefrontal cortex, the part of the brain responsible for executive decision-making, impulse control, and evaluating consequences. Scientific research using neuropsychological testing and neuroimaging has found that early dementia causes reduced activity in the orbitofrontal cortex, a region critical for weighing rewards and risks. As a result, individuals may overestimate their abilities, underestimate dangers, or act without considering long-term effects. Poor judgment also affects personal safety. Someone might leave doors unlocked, wander outside alone, or ignore health symptoms like chest pain or infection. Others may neglect hygiene, wear inappropriate clothing, or skip medications, not from laziness, but because their ability to prioritize tasks has weakened. Social judgment often declines too. People may make inappropriate comments, misread social cues, or overshare personal details. Families may notice personality changes, a once cautious person becoming reckless, or a once trusting person becoming paranoid. These shifts are emotionally difficult for both patients and loved ones. Families may feel frustrated or helpless, especially when trying to intervene without appearing controlling. Experts recommend responding with empathy and structure, not confrontation. If poor judgment becomes consistent, seek professional evaluation. Doctors can rule out frontotemporal dementia, FTD, a form particularly associated with personality and judgment changes. Early legal and financial planning, such as power of attorney and healthcare directives, ensures safety and dignity while the person can still participate in decision-making. 4. Disorientation to time and place. Disorientation to time and place is one of the most concerning early signs of dementia. It often starts subtly. A person might forget the day or confuse morning with evening, but gradually becomes a consistent pattern of confusion that disrupts daily life. This symptom reflects the brain's declining ability to process spatial and temporal information, which depends heavily on the hippocampus and parietal lobes, areas that are among the first affected by Alzheimer's disease. In the early stages, time disorientation might appear as losing track of dates, months, or seasons. Someone may believe it's winter when it's actually summer, or think only minutes have passed when hours have gone by. They may struggle to understand the sequence of events, forgetting whether something happened yesterday or last week. These challenges occur because dementia disrupts episodic memory, the system that records when and where experiences occur. As the disease progresses, spatial disorientation becomes more pronounced. People may get lost in familiar places such as their own neighborhood, or even become confused within their own homes. They may forget room layouts, take wrong turns, or misinterpret maps and GPS directions. This happens when the posterior hippocampus, which helps the brain create mental maps and spatial awareness, begins to degenerate. These changes can have profound safety implications, leaving a stove on, wandering outside at night, or being unable to find their way home. Disorientation may also cause inappropriate clothing choices, like wearing a sweater in summer or pajamas during the day, not due to stubbornness but genuine confusion about context. Research using functional MRI, fMRI, and PET scans has shown that people with early dementia often exhibit reduced activity in the default mode network, DMN, the brain system responsible for orientation, self-awareness, and recalling time-based memories. This neural disconnection explains why individuals lose their sense of when and where they are. Emotionally, disorientation can trigger anxiety, agitation, or fear. People may feel out of place in familiar environments, leading to distress or withdrawal. Family members often notice the first signs when loved ones start missing appointments or getting lost during simple errands. Early medical evaluation is vital. Doctors can perform cognitive tests like the Mini Mental State Examination, MMSE, to measure orientation ability and identify reversible causes such as medication effects, vitamin deficiencies, or thyroid issues. When dementia is confirmed early, interventions such as structured routines, visual cues, and GPS tracking devices can greatly improve safety and quality of life. 3. Language problems. Another common early warning sign of dementia is language difficulty, also known as aphasia. This goes beyond simply forgetting a word now and then. People with early dementia often struggle to find the right words, follow conversations, or express their thoughts clearly, and these issues gradually worsen over time. In the early stages, the problem usually begins as word-finding difficulty, known medically as anomia. A person might pause mid-sentence, searching for simple words like pen or chair, or describe an object instead of naming it, saying the thing you write with instead of pen. These aren't occasional lapses. They reflect real disruptions in semantic memory, the system that stores meanings and vocabulary. As dementia progresses, comprehension also declines. Individuals may lose track of conversations, repeat questions that were just answered, or struggle to follow discussions involving multiple speakers. Group settings become especially overwhelming because the brain can no longer process and integrate fast-changing verbal information. Research from the Alzheimer's Disease Neuroimaging Initiative, ADNI, shows that these language problems correlate with atrophy in the temporal and parietal lobes, particularly in the Wernicke's and Broca's areas, regions responsible for understanding and producing speech. Brain scans often reveal reduced blood flow in these areas, explaining why communication becomes increasingly difficult. Reading and writing skills are also affected. A once avid reader may find it hard to follow storylines, rereading the same paragraph repeatedly without comprehension. Writing may become messy or disorganized, with frequent spelling mistakes or repeated words. Some individuals develop repetitive speech patterns, telling the same stories multiple times without realizing it. Emotionally, language loss can lead to embarrassment and social withdrawal. People may avoid conversations out of fear of saying the wrong thing, causing isolation and depression, which in turn can worsen cognitive decline. The good news is that speech-language therapy can help. Specialists can teach strategies such as using visual aids, simplifying language, or practicing word associations to strengthen remaining language pathways. Research published in Frontiers in Aging Neuroscience shows that speech therapy and cognitive exercises can slow language decline and maintain communication skills longer. If language issues begin to interfere with daily interactions, whether through confusion, repeated words, or difficulty following instructions, it's essential to consult a doctor or neurologist. Early evaluation can identify dementia or other neurological conditions and ensure the right interventions are started promptly. 2. Difficulty with familiar tasks. One of the most telling early indicators of dementia is when someone begins struggling with routine tasks they've performed effortlessly for years. These aren't new or complex challenges. They're everyday activities like preparing a favorite meal, balancing a checkbook, or operating a familiar appliance. When these once automatic behaviors become confusing or frustrating, it signals deeper neurological changes in the brain. This difficulty arises from a breakdown in procedural memory, the type of memory responsible for performing learned tasks, and in executive function, which helps us plan, organize, and carry out multi-step activities. These functions are primarily managed by the frontal and parietal lobes of the brain. In dementia, especially Alzheimer's disease, these regions show reduced glucose metabolism and loss of neural connections, which disrupt coordination between thought and action. At first, the change is subtle. A person may take longer to complete familiar routines or forget a step in a process they've done countless times before. Over time, these challenges grow more noticeable. Someone might forget the sequence of a recipe, become confused using household electronics, or struggle to follow instructions on a device they once used daily. Even modern tasks like using a smartphone or computer can become confusing. Icons that once made sense suddenly look unfamiliar. Driving may also become risky as individuals forget routes, overlook signs, or become disoriented in known neighborhoods. Financial management can also decline, with missed payments, duplicate transactions, or misplaced records becoming common. Scientifically, these struggles are linked to neuronal degeneration in the prefrontal cortex and disruption of the brain's default mode network, DMN, areas that handle attention, planning, and multitasking. Studies using functional MRI, fMRI, have shown that even in early dementia, these brain networks show decreased activity and connectivity, especially during tasks requiring concentration and sequencing. These cognitive difficulties can lead to emotional changes too, frustration, anxiety, and even withdrawal from social or household activities. The person might lose confidence, worrying that others will notice their mistakes. It's important to differentiate normal aging from dementia-related changes. Occasional forgetfulness or a misstep in a busy day can happen to anyone. But when difficulty with familiar tasks becomes frequent, distressing, or interferes with independence, it's time for a medical assessment. Sometimes, similar symptoms can result from medication side effects, vision or hearing loss, thyroid imbalance, or depression, so getting evaluated helps identify the true cause early. 1. Memory problems. Memory loss is often the earliest and most noticeable sign of dementia. But not all memory lapses are cause for alarm. The difference lies in how much the forgetfulness disrupts daily life. Occasional forgetfulness, like losing your keys or struggling to recall a word, is part of normal aging. It usually happens because of slower retrieval from long-term memory, not a loss of memory itself. In contrast, memory problems related to dementia stem from neurodegeneration, especially in the hippocampus, the brain's memory center. Here, beta-amyloid plaques and tau tangles interfere with communication between neurons. As a result, newly formed memories fail to stick. People in the early stages of dementia often forget recent conversations or events, even after reminders. Ask the same question repeatedly, unaware they've already asked. Struggle to remember appointments, meals, or where they placed everyday items. This is known as short-term memory impairment, while long-term memories, such as childhood events, remain relatively intact. That contrast often confuses family members. A person might clearly recall something from 40 years ago, but forget what they ate for breakfast. Emotionally, these lapses can be distressing. Many people recognize something is wrong and try to compensate by taking notes or avoiding conversations. Family members may notice repeated storytelling, confusion in routine tasks, or forgotten names of close relatives. A study published in the Journal of the American Medical Association, JAMA Neurology, found that episodic memory decline is one of the strongest predictors of early Alzheimer's disease, often appearing up to 5 years before diagnosis. If memory loss begins to interfere with independence, such as managing finances, cooking safely, or navigating familiar places, it's time to seek medical evaluation. Doctors may perform cognitive tests like the Mini Mental State Examination, MMSE, or Montreal Cognitive Assessment, MoCA, and sometimes recommend brain imaging to rule out reversible causes. Early diagnosis doesn't just identify dementia. It can also reveal treatable conditions such as vitamin B12 deficiency, thyroid imbalance, or medication effects that mimic cognitive decline. Remember, occasional forgetfulness is human. Persistent memory disruption is not. The sooner it's checked, the better the chance to slow progression and plan ahead with clarity and dignity. If you found this information helpful, give this video a thumbs up, share it with someone who might benefit, and subscribe for more science-backed insights on maintaining brain health and early dementia awareness. Thank you for watching, and I'll see you in the next video.